Dr. Derek Helton. We're colleagues. I've known you for some time now. You're an excellent oncologist. And as a medical oncologist, seeing and treating people with all types of cancer, you've been actually spending a lot of time and specializing in gastrointestinal malignancies.
Right.
So I understand today you're going to talk to us about colon cancer.
Right.
So why don't you share the wisdom and educate us on colon cancer?
Certainly. I wanted to take some time today in particular to talk about what to expect after a diagnosis of colon cancer has been made. We'll also be talking about colon cancer screening and prevention. That'll be the topic of another episode. Oftentimes a colonoscopy is done either for routine screening or because of a symptom or a bowel problem that someone is having. And after a biopsy is done, you meet back with your gastroenterologist and you hear the word cancer that comes up, colon cancer. And it's very overwhelming at that point. Many things begin happening at once, including referrals to other doctors. And I wanted to speak to what to expect after that happens, and to discuss how the role of surgery and then the role of chemotherapy may or may not be important after that in terms of trying to prevent a recurrence. Also what to expect with chemotherapy if that's the case, and then how one is followed after completion of all that in the years down the road to observe for any possible recurrence in the hopes, of course, that that does not happen. So after a colon cancer diagnosis is made, a referral will be made to a surgical specialist. It may be a general surgeon, it may be someone who specializes in colorectal surgery. A referral will also be made usually to a medical oncologist, which is someone like myself, who specializes in chemotherapy and who is ultimately, so to speak, the quarterback of the oncology care in that setting. The referral to the medical oncologist like myself might come after seeing the surgeon, or it may come beforehand. What will happen at that point is a series of pictures will be taken called scans, usually CAT scans, to also assess your other organs in the body to ensure that it has not clearly spread somewhere distant, such as the liver, for example, or another organ. Assuming that is not the case, then the surgeon will be speaking with you about an operation, sometimes an open operation, sometimes one that can be done laparoscopically even, where a portion, usually up to half of the colon, may be removed in order to remove the cancer itself and get a nice margin of normal colon around that cancer, as well as a sampling of what are called lymph nodes within the area, since that's one of the first places that colon cancer may spread to when it's on its way potentially to other organs. And so the surgeon will remove all of that, after which there's a healing and a recovery time physically. And then the pathologist will spend a good deal of time at your hospital looking all through the surgical specimen under the microscope to be able to give me information about what the cancer cells themselves look like under the microscope, as well as where the tumor has gone to within the wall of your colon and possibly to any lymph nodes. That leads to what we call a stage, which not only helps with prognosis, which is assessing the risk that it might come back, but also then is able to allow me to make a recommendation after surgery on whether or not chemotherapy would be recommended as a way to try to lessen that chance of recurrence. So what will happen is you may see an oncologist like myself before surgery, where we go over that before surgery. If not, I often will see patients also for the first time after surgery, and we already have the pathology report at that time. And to simplify the staging, part of it amounts to how far the tumor has gone through the wall of the colon itself. The more it has invaded through the wall, the higher the stage generally. And also whether or not it has spread to any lymph nodes, which would then include a higher stage. For example, lymph node spread would be called stage 3. Stage 4 disease is metastatic, where it has gone to another organ like the liver or lungs, that would have been picked up on a scan that we talked about at the beginning. Treatment in the metastatic setting is another important topic of conversation that I want to come to in another conversation, and we will do that. For the purpose of discussing chemotherapy after a diagnosis, assuming it is stage 1, 2, or 3, so limited to the colon or possibly some lymph nodes, we will derive that stage after surgery based on what the pathologist sees under the microscope.